the Outlaw Blitz podcast, Big Fella, and Mr. Stracuzzi. Let's get dangerous.
Yes, the Outlaw Blitz interview podcast. It's been a while since we've been in studio to do one. And I'd like to welcome to the show today Patrick Stracuzzi FNP-BC, which stands for?
Family Nurse Practitioner, board certified.
All right. So we've been trying to put this together now for a little while, and finally the stars have aligned. We have you here today, and it's something that we've really been excited to get you in to talk about. Alternative medicine. It is the world. I mean, it's the way things are going now, because a lot of people are tired of dealing with mainstream. They're not getting the results that they feel they need.
Yeah, a pill for every ill. Yeah.
You want the alternative, but it's kind of almost being more mainstream than alternative anymore.
Yeah. There's very few people that I know that are either practicing medicine for a while or getting into medicine that, are looking for the traditional, go to med school, hand out a pill and, don't really go to the root cause of the disease. There are some people that just want to, do the status quo, but the status quo has become, like you said, more holistic, getting actually to the reason why, the root cause of most diseases. So definitely fascinating. Never thought I'd be here, but it's definitely something I want to do. So
now, let's get a little bit about your background. You grew up where?
I grew up local, so born in Westchester County, but spent most of my childhood and adult life right in Kingston, New York. Now me and my wife and kids live over in West Hurley. But Hudson Valley boy, basically raised, born and raised.
All right. Yeah. And after high school, where'd you end up going?
I wanted to be like my older brother, and so I wanted to, be in the military. I wanted to be the Marines, but he said I wasn't tough enough, so I ended up joining the Chair Force, the Air National Guard. So I did some time in the military down in Stewart Air Force Base, and traveled around a little bit. Basically spent most of my late teens, early 20s, traveling with the military while I was in going to school at the same time. So always like to stay busy and motivated. But so military, then it was nursing school, then it was slaving away for insurance-based medicine at the hospital, a couple nursing homes back at the hospital, then I was in school at the same time, started going, basically got some experience, went to school, and then quickly realized that the traditional insurance-based medicine route was a way to be miserable for the rest of your life, basically.
I said to George before off air, I remember having you, and I remember my grandfather having you as well.
Yeah.
In the hospital. So
it's unfortunate when you work for a big conglomerate like that, or just insurance-based medicine in general. It's just even as a patient, you feel helpless, but as a provider, trying to actually provide real care is really where you feel like the least fulfilled, when you have someone that's sick, or basically want to tell them that what we're doing is really not going to do much for them. But it comforts, most of the time it comforts the patients, but realistically providers feel helpless in so many ways.
Did you have a come to Jesus moment, like waking? You woke up and you said, "Man, I am done with this. Do something different."
Yeah. So probably when we had a few things happen. First, it was a burnout kind of happened, and a lot of I bring it on myself, but working locally at a local hospital and seeing a bunch of 25, 26, 27, up to like 40-year-old men and women coming in and just like sick all the time. And no matter what you do, you can go by the book and tell them to do this and this, but when there's one, not enough resources in the community, and two, when people just they don't want to hear from someone in a white coat like you gotta exercise more, and you gotta eat healthier, and then you ask a provider and they say, what do you mean by eat healthier? And most providers and most people in medicine, they don't know what the hell they're talking about either, so like they're reading this checklist saying, oh yeah, you have to smoke less. And then, you ask them like, why is smoking not good for me? And most people, a lot of providers, they don't know why smoking is bad for you, or like you have to eat more vegetables, and you have to, the basics, that you're trying to instill in people. Most people don't know how to actually like connect with people. And that was the first aha moment. And then myself, so I was like 26, 27. I ran labs on myself, and I looked at my biomarkers, and I'm like, Jesus Christ, like I had the testosterone for a 90-year-old man. I was, my total testosterone was like, 170, and it's not, where you want to be at any age, let alone a 27-year-old. And I was newly dating my wife at the now wife at the time, and I always joke around and tell everyone, I chased my wife for a year and a half. I was like basically married to the friend zone. So 6 months in of dating, I'm not feeling myself because everything okay. I'm like 27, on top of the world, making good money. I got a woman of my dreams, and I mean, it was hard for me to get out of bed in the morning. I had no libido. As a 27-year-old man, you're like, what the hell's the matter with me? Am I dying? So, and I knew, I thought I knew what was going on. So anyway, I, go to my primary, and my primary doctor's cool. Like I talk to him like I talk to my patient. We kind of shoot the shit, whatever. And he basically said to me, he's like, listen, man, like your testosterone is low. Your insurance isn't going to cover it. I was like, what do you mean? He's like, you're low. They're going to make you jump through hoops. And, that was my real big aha moment, like to actually provide real care. They want you to do a $1 million workup. So, and to this day, I mean, I know what the issue, what caused my low testosterone, but like my primary didn't, the board certified endocrinologist that I went to didn't, the urologist that I went to didn't. I mean, yeah, they stuck their finger in my butt and ran more labs, but no one could, explain why a 27-year-old man was having, had low testosterone. And, it's just like a whole big gimmick, and, insurance companies don't want to pay for it, not because it's not warranted or safe, but because, they don't believe that it's the cause of people's problems. So, it's like a very big scenario and very common,
Right.
We have men and women. I have men and women that come over to our practice, and, they're depressed, they're having, anxiety, they feel like there's, life isn't worth living, and they're sick of here's an antidepressant. You're probably depressed, and you put a 27 or 28-year-old man on an antidepressant. It's like the worst thing for him. Off the record.
And I've been taking it for 10 years.
Yeah.
So can blood, like a good blood doctor or blood results, show you a lot of that stuff that you don't need an antidepressant in reality if you go through the blood work the proper way.
So I guess there's more than one way to skin a cat, they say, right? But most, and this is going to sound, I've gotten a lot of pushback from psychiatric providers that are in this, group that I'm a member of. I spoke at a couple of weeks ago in Vegas. But if you have someone that is depressed, and I mean not like there's a whole bunch of mental health ailments, but a young man or woman who's just depressed. And and I have a lot of people that fight me on this. If your first instinct is to give them an antidepressant, you are not doing them any service. And it happens to anyone. Any scenario you could think of. You're a man. You're having issues with your wife, or your kids, or your job. And you go into your doctor's office, your healthcare provider's office, and the first thing they do, and I have a lot of patients say, if the first thing they do is they give you an antidepressant without running labs, get a goddamn new provider. And that sounds terrible, but it's the truth. And my biggest frustration is when I do it to young men, and even more so postpartum depression. Like when you have a woman that, has a baby, as providers, medical providers, the first thing we do is, you're depressed, so let me give you this medicine. And I fought with a few, local doctors on this. I'm like, you're giving this woman or this man, if it's not someone that's pregnant, an antidepressant. What is your reasoning? Why are you giving that? What are you replacing that is causing that depression? And I'm like, what do you mean? I'm like, you're giving someone a drug that's going to alter their brain activity. Why? And they're like, well, they're depressed. You need more serotonin. I'm like, okay, so 2 months ago they didn't need an antidepressant, and now all of a sudden you need an antidepressant. Like, why? Like, at a level, at an individual level, I don't get mad at any one provider. It's more of like a system,
Right.
So if you look at like the causes of depression,
right?
Like when a woman has a baby, what happens? And I asked providers, what do you mean? I'm like, when a woman has a baby, the first thing that happens, her hormones are out of whack. So if you talk to OBGYN doctors that don't practice in an integrative way, or primary care providers, I'm not going to touch their hormones because, it's going to throw their hormones are going to be out of whack and they're going to get better. And I'm like, so you don't want to give someone hormones to kind of help them feel better and
to balance it.
To balance it. But you want to give them
give a pill to compensate for it.
And my thing is this, is that I'm going to lay out a scenario at a conference. I can't take credit for this. A buddy of mine, who's another speaker, said it. But psychiatry, is the only thing in medicine that has no objective data. There's like a questionnaire that we give people, the PSQ-9, right? And it's just, simple questions. And, how do you feel? They would go through the whole thing. But there's no data showing that it has any statistical relevance. Could you imagine if it was another scenario, if you go to see your cardiologist, you go to the ER and you say, "Oh, I'm having chest pain," and no one runs any tests on you, and the cardiologist, the local ER doctor comes in and says, "Oh yeah, it sounds like chest pain, but you probably don't have it. So I'm just gonna give you this pill. Come back in 6 to 8 weeks and see if you feel any better." Like as a patient, like this fucking guy's a lunatic.
Right.
Dropped in the parking lot.
Right.
Yeah, that's what I'm saying. So it's like, but in psychiatry, in most primary care providers or psychiatrists, we accept that. Oh, it's a questionnaire, and it's like, how is that acceptable if you're not actually looking to see what's causing that young man or young woman or any person's depression? But I mean,
so during COVID time, the video, the chat version of a doctor's appointment must have driven you absolutely fucking insane.
Yeah, and I have like a mixed belief. I mean, from a business standpoint, COVID was great for that. Because virtually, giving people hormones and stuff. There's always like a inverse relationship with it because there's more access to care, but there's a lot of people that have taken advantage of that and basically giving people whatever they want. Oh, like that's what happened with these clinics that hand out Adderall like they're made of candy. They're all getting in trouble, but it's the face-to-face aspect is okay, but the in-person is obviously more rewarding for most providers, but. For like hormones and stuff like what we do, most of it can be done virtually as long as everything's done within reason. Like I always joke around, like there's no reason for you have to come to my office and get hormones if you can inject yourself at home. But yeah, what really drove me crazy is like how all these during COVID, all these psych clinics popped up and people are getting antidepressants and Adderall, and it's like instead of actually figuring out like for the last 3.5 years, people have been, pretty isolated, I went through it. Most people, went through, isolated, humans, we are creatures that aren't supposed to be isolated away from each other, so it's, one of those things where,
So take us through, like, we kind of know why you did that,
Yeah.
but why did you choose this exact route? Like, how did you come to like, hey, I'm going to do a wellness thing that concentrates on X, Y, and Z?
Yeah. So when I originally first, I've always had like the itch to be, I guess you'd say, an entrepreneurial drive, although I didn't really know at the time. But I always felt like, I wanted more, like wanted to change or help. I wanted to help people the way that I think that medicine should be. And when I first opened, I was going to do just straight, regular, regular primary care. First, it was going to be insurance based, and I was like, no, let me just do like cash only, like we call it direct primary care. Which we still, we do a lot of it, but, after realizing what was going on with me and actually getting myself, getting myself treated with hormones and everything, I realized that there was a significant need. So that was the first niche, was like, there's a lot of men, the whole stigmatism that, men, every man that wants testosterone is just trying to be a bodybuilder. And it's like, that's just a load of rubbish. I think that's, 10, 15, 20 years ago, stigma, and now it's starting to change. But, I really felt like the biggest need at the time to start out was like men, someone like me, that was borderline, going to break up with my, now mother of kids, seeing how it basically affected every aspect of my life as far as improving it, with simple low dose, hormone replacement therapy, testosterone. It's like, it's like night and day. So that was my first niche. And then as I started doing that, I just was like fascinated with integrative medicine and actually trying to get to the root cause. And then now we do hormones for women as well. And then weight loss, we're not like a lot of these other clinics that just basically give you a script and never don't care to want to see you again. We do weight loss, and obviously like the semaglutide and the Ozempic, the Ozempic and Mounjaro, and all the ones that are available, we do them. And a lot of these other clinics, and I don't discredit anyone if you want to, charge an arm and a leg, but our goal is to focus on helping people. But we're really trying to help people get to the root cause of why they're gaining weight. So yeah, I mean. Obviously with the obesity in America and the hormones, being messed up. Honestly, you treat someone, you optimize their hormones, you really don't have to worry about helping them lose weight because that's going to, correct itself out. But, yeah.
So would you say you're kind of pretty much based as a hormone therapy?
Yeah. So, that's probably our main bread and butter. We're basically a hormone based, I guess you would say we're an integrative clinic focused on hormones, weight loss, and peptides. Not only, growth hormone releasing peptides, but we help people with, inflammation and, we do a little bit of gut health. And probably in the next 3 to 6 months, we'll probably be more officially doing like a whole integrative, so you can come to us for regular normal stuff for functional medicine. I mean, I do a lot of it myself, but we're up to like 12 we have 12 providers in 31 states. So the goal is to get everyone, the other providers caught up to speed as far as what we're trying to do. In a ideal world, probably the next 2 to 3 months, or I don't know whenever this is going to be aired, we'll probably be like a full blown, instead of going to your primary care doctor for, high blood pressure and getting put on a, antihypertensive drug, we can manage you and get you on, more natural remedies and actually address the underlying, root,
Are insurance companies coming along with this now?
There's a lot of functional or integrative providers that are really pushing the tide on it. So I think, a lot of my patients, we give them like itemized receipts, and most of them, if they're anywhere in like law enforcement or like anyone with really good insurance, we don't accept insurance, but most people can get their, about 80 to 85% paid back from their health insurance. It may take like a month or so. So what we do on ours, we just give you like an itemized receipt with like the diagnosis codes we use for, the visit. And insurance companies, you still cover the labs for people, which is the most expensive part. So we don't charge cash or anything extra for the labs. We basically send people either LabCorp requests or just another lab, locally to where you are. But the insurance covers them, no problem, because, the questionnaire, the symptoms that people have, you can get that labs covered 99.9% of the time.
So why don't we do we'll walk it through, because
Sure.
I have some of what you do
Yeah.
spread out, but let's walk it through. One of us are coming in to see you day one. How does it work?
So, the easiest way, the quickest way is, we have a whole system online. So basically when people reach out, whether it's directly through our website or right now we have a big marketing campaign going on Facebook and Instagram.
So I have you at Stracuzzi Wellness Center, Kingston, New York, 845-481-3165.
Yep.
That's running across the bottom of the screen.
Yep.
You can call that number.
Yep.
And then, or you can go online
Yep.
and fill out a questionnaire.
So basically you go to the website, improveyoutaday.com, and, it'll have you fill out like the contact information. And, we're pretty automated to the point where as soon as you click that button, it goes right to all of the people that work at the office, all of the staff. We have some good rock star, office staff now, which is great. But, we have intake forms that basically go over questionnaires you can fill right on your phone or right online within, 5 to 10 minutes, and it goes over everything. And based on those symptoms, and what you're interested in, it's basically laid out. So if you're interested in hormones, weight loss, peptides, we do a little medical marijuana evaluations as well if you're in New York State. And also if you're locally, we do like IV fluids and stuff. But
is that improveyoutaday.com?
Yep.
All one?
All one word. Yep. Yeah.
So I'll run that on the end of there too.
ImproveYOUtoday.com. Yeah.
Okay. Cool.
Yeah, and probably in the next 3 to 6 months, the name should be changing to that. But right now, it's still Stracuzzi Wellness. But now that we have good staff and other providers, I really want to make it more of a. I don't want it to be my name. We're trying to make it like a community. But you basically fill out the questionnaire. So how the process works is you fill out the questionnaire, with the intake forms, and then in real time. So as soon as you get the forms and they're filled out, we send a script, right to a LabCorp or Quest. And then, most people, if you're going to do hormones, the lab work is required, because we do, you go to your primary and ask for regular lab work. They're not going to check, what you need, testosterone, a free and total testosterone, an estrogen, an IGF-1, which is something that measures, your insulin-like growth factor 1, and CBC, CMP. We run a full comprehensive thyroid panel, hemoglobin A1C, a bunch of biomarkers. We check like a lot, and if you're over a certain age and you're having, symptoms based on your questionnaire, we'll check like a PSA. But once the blood work is done, basically once you get through the questionnaire and the blood work is done, or you go to the lab, we get you on the schedule to see, myself or one of the other providers. Usually the first visit is virtual. It's kind of like, oh, hey, how's everything going type of a thing. And if they want to move forward, it's super simple. Right now with COVID, we're doing mostly virtual. And it's, great. We work with compound pharmacies. So like if you're on hormones, for example, the medication gets delivered directly to you within like 4 days of being seen. It's, pretty remarkable what to have, what we're able to do as far as giving people care.
Is there a way, now this could be completely not in the normal way, right? Like, because you have people that are drug seekers, right?
Mm-hmm.
The blood test, like somebody going, I just need testosterone. Well, you're going to test them first before you ever do a TRT.
Yeah, so, there's a lot of clinics and this is why there's a lot of providers or a lot of agencies that are against online for that reason, because there are some clinics, and we're not them, but there's clinics that actually will send you an at-home test kit. So like if you want testosterone, I don't want to throw shade or discredit any other clinics, but the clinic that I had to go to myself before, we had other providers and that work with me that can actually prescribe for me and manage me correctly. That's how it worked. You basically go there and they give you a finger prick. You prick your finger at home and then you send it back to them in like a little like spot lab, and it's like there's data supporting that it's valid, but it's like you don't know if that's mine. I could swap it out with my daughter. You know what I mean? It's like some sketchy shit.
You can say it.
Yeah, some sketchy shit. So that's why and I have friends that do that, and I'm like, listen, man, that's how you want to do it, but I'm not. It's too risky for me. You start people on hormones, and like,
well, if it ever comes back too, right?
Yeah.
So like, if somebody comes in and says, "Hey, we see your labs prescribing this," you could say, "Here's the blood. Like, here's the panels.
Oh yeah.
I have all the full blood work. It's not just a little spot check."
Most people that are against hormones, whether it's like another healthcare provider or people that loved ones, it's usually because of the an outdated belief that hormones are bad. You talk to people that have been around in medicine for a while, they would tell you, like, especially for women, for example, back in the day, women that were going through post menopause or even like before, like premenopause, putting them on like low dose estrogen and progesterone and even testosterone was like normal. And then some BS study came out, back in like 2001, 2002, and scared everyone. It's really fascinating, and this is why a lot of people think like, oh, you're brave, man. I would never talk about this, stuff I talk about. I tell everyone I'm not afraid of getting sued or getting yelled at by like regulatory agencies. I'm not saying FDA or DEA come knock on my door, but what I'm saying is that whether it's medicine, whether it's construction, anything you do in this world, when you operate out of fear or misinformation, that is when you're gonna really at your core be something that you're not supposed to do or be. It's like, so hormones, it's coming around. I think it really is coming around. Like even for women, like there's a lot more providers that are realizing that sometimes data and studies are skewed, and there's always ulterior motives. It doesn't matter whether it's medicine or law enforcement, whatever. There's always an ulterior objective to why someone's pushing something on you. So
right.
But yeah, to answer your question, I've had a few people who have came up positive with testosterone. Mostly people in law enforcement. Cops or
or like firemen and stuff like
firemen. That. Yeah, so like.
Have most military guys too?
Yeah, military. So most people, it's like a random, like most normal police officers or corrections officers, a standard like drug test just checks for like the 12 count, street drugs, so they're not going to test that. But there are some instances like if a person's on SWAT, or usually what a lot of people have told me, like in the NYPD, if like there's an incident where a shooting happens, or like they think that the cop may have been aggressive, then they'll draw a panel. And most of the time, I mean, I've never had a police officer has gotten suspended or anything because of hormones, because it's justified. You show them lab work, they've been evaluated, and they're basically, we're not treating them to be a bodybuilder. We're treating their, depression. We're treating, helping them, improve their quality of life. So definitely legitimate. And, I think hormones is going to be the future. Proportionally, there's a lot more people that are looking for hormones than antidepressants. At least people that are not on, certain medications that are supposed to help improve quality of life versus certain traditional remedies.
I'd like to say that as a society we've moved on from some things, but do you still face skepticism because of liberal media and the athletes that have gotten banged for PEDs, and because in their field it's put into a negative light?
Yeah.
So now it spills over to you, and how do you answer those critics?
I actually have I think that there should be, as far as like athletes, I think there should be 2 leagues in every major sport. Why as humans, like if you have an injury, you have surgery to get back to your optimal level. Like that's what your goal should be. So like, wouldn't it be nice if, you watch a football game and there's, the New York Giants versus the Cowboys, and then there's the enhanced New York Giants versus the enhanced New York Cowboys? Because my thing is that, like, as an athlete, I mean, I was a, amateur boxer, and I wanted to be basketball, but I'm not coordinated enough. But anyway, as a athlete, like your goal is to train to be at your highest level. And isn't it kind of like, from an entertainment standpoint, I don't care if you're on, testosterone, optimize your performance. And there's actually, UFC, there's a lot of people that fight in MMA. And basically, a lot of like contact sports, they have a guideline that basically says is that, they check your testosterone level. And there's a lot of people that actually have been on it, and they basically just as a way to manage it to make sure that their levels are within a certain range. Like I think it's like 1,000. Your total testosterone can't be over like 1,000. But if you're like on low dose hormone or something to boost your levels and it's under that 1,000, I think it's great. And I have no data to support it, but there's no way that the major athletes that have been doing this for 15, 20 years, they're not on some type of
Right.
And a lot of them are on peptides, which is like the future. So
and they deserve a right to be healthy.
Yeah, that's what I'm saying. It's like you tell these people, a lot of people say, they're athletes, so quit crying. You can't do you can't do hormones and optimum. I said, well, you want these people to perform at your highest level. Like if that was you, if you were a 45-year-old man that got injured, and someone said, hey, if you take a peptide or like low dose testosterone to help heal an injury and get your life and your energy back, I'd want that. If I'm like debilitated or if I want to get back, like I'd want that. Now you're telling me that because this person can jump and dunk a basketball or can throw really far that they can't get to that next level. Like what are we doing as a society if like it's justified for one person, but for certain people, you have to be blunted or, not be at your level.
I look at it like this is they're already there because they can do it at that advanced
Yeah.
level.
Yeah.
Why not let them get to the most that they could possibly do?
Well, because there's overdoing it.
Yeah.
That's always the argument.
Right.
Yeah.
Ken Caminetti in baseball was a great player until he blew up on steroids and I think looked like a popsicle stick in his hand.
Yeah.
Well, we're looking at probably an era where it was not regulated
Yeah.
No,
like it is now.
But I think to his point a little bit is if you measure, like I never heard of TRT until the UFC.
Yeah.
Right? And I'm like, wow, what is this?
Yeah.
But then Vitor Belfort at 41 years old had testosterone that was like higher than a 20-year-old fighter.
Right.
Because he overdid it.
Yeah.
Right.
But at the same time, if he took none, what would the testosterone levels be?
Yeah.
The difference between a 40-year-old and
how low would
a
he be?
healthy 25-year-old?
Right.
Exactly.
Right. So like, I get it having a number like you said, 1,000.
Yeah. If there's like strict criteria, I don't see why not. Because if
You want the level playing field.
Yeah, exactly. Level playing field. My thing is like look at all these athletes that have done the Barry Bonds and all this stuff. It's like that's unacceptable. But look what's going on now. Where like if a woman wants to be a man, look what happened with the NCAA. Like
Right.
You don't know that person. That man could have taken hormones to optimize and and make him perform better. Wouldn't it be nice if like that man that won the NCAA that was like competing with women? Wouldn't it be nice if okay, I'm going to check your testosterone level. You're 20 or whatever it is. You have a testosterone of 700. I'm a girl. My natural testosterone is 35. Okay, if you want to race with me, let me take testosterone to get in 700. Of cutoff, and to standardize it. That way, you take the emotional, non-objective out of it. Because depending on how you feel on whatever topic.
Well, you just touched on something huge here.
Yeah.
So I do not want to see a trans athlete male go against females.
Right.
They're physically completely different.
Yeah.
Even if they're taking estrogen to like to do the change and the testosterone blocker, naturally their body's going to have substantially more testosterone. Correct.
Yeah. Yep.
So that's a major advantage in any way.
I think it's a rough. It's a difficult topic to talk about, in today's world, obviously, and like as a healthcare provider, I think if you want to be an opposite gender or, whatever your pronoun wants to be, that's not what this whole topic is about, right? And that's what the gray area, when you start to bring this up, people get emotional. They're like, they're triggered, but it's not fair. It isn't fair no matter what way you look at it. But yes, I completely agree. I don't want, could you imagine like the movie that came out back in the early 2000s, Joanna Man, like
Right.
LeBron James when he's like 45, he's like, you know what, I'm retired, I'm feeling a little bored.
I was just going to bring LeBron into this because he's in his 21st NBA season. He's in his 40s now. What if he stepped away and in 3 years from now, you know what, I identify as a female?
Yeah.
Well, that's what Dave Chappelle says.
Yeah.
Dave Chappelle says it best. He goes,
Exactly.
where LeBron James scores 840 points a night.
Yeah, it's like, and like the way the, world is, it's like, like that probably can happen, it's like,
right.
Is that fair to the WNBA players? Like, you know what I mean? It's like,
Right.
you want to talk about equality for men and women. Like, is that fair,
Right, or like Tiger Woods at
Yeah.
45 goes to the women's PGA and drives the ball 300 yards.
Mm-hmm.
Right.
You know what I mean? So testosterone replacement therapy is one of your one of your things. I had a question I asked people like, hey, you got any questions? It says, there's been some science that says it makes the prostate enlarge. And then there's other ones that say, no, it doesn't. Can you speak on that a little bit?
So yeah, over the last like 3 to 5 years, there's been a lot of studies that have come out. And actually the American Urology Association came out, I think it was like 2 or 3 months ago, they came out a report and basically showed what most people that practice this type of integrative, treatment, said all along. It is more than just, you're a 45, 50-year-old man, you start testosterone replacement therapy. 10 years from now, your prostate's going to get enlarged and you're going to get more risk for prostate cancer. It's like anything, most things in medicine, it's more of, lifestyle and family history. So certain demographics, people of color are a little bit more higher prone to prostate cancer. But it's kind of fascinating. Like prostate cancer, for example, if you do have prostate cancer without hormone replacement therapy, say you're like a normal 55, 60-year-old man, you get diagnosed with prostate cancer. Standard treatment, if it's early enough, they'll, do radiation or, maybe they'll take your prostate out. People don't realize, what happens about 6 months to a year after you get your prostate out? You're going to have sexual side effects. You know what you're going to do? You're going to go back to that urologist. You know what's going to happen? He's going to start trying testosterone replacement therapy. Most of the time, it's going to be wrong the way they manage it because most urologists don't, this is a blanket statement, but most healthcare providers, they have people do testosterone way wrong, and that's why people feel like crap and stop because they feel good for a couple of days and they feel like crap because they're dosed wrong. But anyway, the standard treatment is, to help this with the sexual side effects and get your energy back. You're going to be on hormone replacement therapy anyway. But we have we work pretty closely with a lot of local and urologists across the country, and now they're all with all the data coming out. They're like testosterone and prostate cancer. There's a chance that if you have an enlarged prostate or you're at risk to it, risk for an enlarged prostate, it can potentially get worse. But that's why a lot of people, and we do it in my clinic, there's drugs like low-dose Cialis, for example, tadalafil. Low dose was actually originally made to help prevent swelling of your prostate, whether you're on hormones or not. That's why it was originally made. It was only during the drug trials that the men were coming back and saying, I'm urinating less at night. I feel great, and my erections are much more stronger. And my wife says my libido's to the roof. And then Big Pharma was like, cha-ching, and that's why it's known as an erectile dysfunction drug. But it was originally made to help with swelling of the prostate. So most clinics, like if I have a guy over like 40, 45, and they're starting testosterone, it's included in our monthly program. Low dose tadalafil, either daily or as needed to kind of help prevent swelling of the prostate. But low dose testosterone replacement therapy, bioidentical, meaning that it's coming from a compound pharmacy, not from someone's bathtub or Turkey. Or,
explain. You've said compound pharmacy a few times. Just explain that a little.
So yeah, so when people get testosterone from CVS or like any drug from a local pharmacy, it's basically a synthetic drug that's made by Big Pharma. So compound pharmacies, they are licensed pharmacists, all legitimate, regulated, actually more regulated than your local CVS or Walgreens Rite Aid. But basically, the pharmacist actually makes and compounds the drug in-house. So it's all made and, it's all in a sterile environment. And so instead of, my clinic paying, CVS or Walgreens, basically, we're paying the compound pharmacy, and they basically, compound it, wrap it up, sterilize, and basically they mail it directly to the patient's house. So, you get it in like, 3 to 5 days after being seen. And it's basically a way to, way cheaper, I can't even imagine, begin to go into detail the price gauging that goes on between, I can get semaglutide, for example, patients when they come to us, they get like a, 7 milligram vial of semaglutide, which lasts, 2.5 to 3 months, for $350. And that same drug for like 2 milligrams of it, is $1,200. Well, it's like, why? What is justifying? What do you?
How's it 4 times the cost?
Yeah, it's like what? It's like insane. My wife's uncle, he's a type 2 diabetic for 20 years. Trying to lose weight, and he got put on this drug. His insurance approved it. He got a $25 coupon, and then the next time he was due for a refill, they denied it. And even with really good insurance, he had to pay $700 a month out of pocket. That's criminal. There's no reason why. There's no effing reason why.
Wow.
But
Now, with your TRTs, are they injectable? Are they oral?
Yep. So there is oral testosterone.
I remember way back when I was trying to have, when my ex-wife and I were trying to have our second child, the doctor, I tested for low T then, so they put me on androgel.
Yeah, androgel.
Just rub it on your arm. And
it's nice. Gel is, androgel is good. We have like a cream-based version of it, which works good. For people that are absolutely against injecting, we do cream. It's kind of a pain in the ass if you're like someone that has kids or like you're married. It's transfer to people, although very rare that it can. But for men that are absolutely against injecting, we do tree cream for with men and women. You just apply it daily, and honestly, it works best to apply it directly to the scrotum if you're a man. But there's cream. And what people don't realize, injectable testosterone now, it doesn't have to be deep in the muscle. So like, when when I have guys do it myself, like the testosterone is a 27 gauge half-inch needle. It's literally like that big. You could do it. You could pinch the fat on like the front of the side of your leg and just go right in the fat, or even what we call like a shallow IM, where you basically just clean the area and just inject right in the leg. You don't have to worry about drawing back for blood. It's super simple. I mean, it's like nothing. And like the way most of us tell people to do is like microdose. So instead of doing like a big injection once or twice a week, you just inject it daily. It literally just takes 2 seconds. Boop, nothing. But to answer your question, there's that, and there's oral testosterone. However, the newer oral testosterone, the compound pharmacies claim it's not rough on the liver. Traditionally, you avoid it because it is pretty liver toxic. But supposedly, there's oral forms. But I personally, at our clinic, we don't do it. It's just not worth the risk.
All right, so we covered TRT. We're good?
Yeah.
All right,
Cool.
Let's move on to peptides.
Okay, cool.
Explain to me what a peptide is. A lot of people, like you hear peptide, they think steroid. So what's the difference between a peptide and a steroid?
So peptides basically are amino acids, basically. So, a protein is any type of amino acid that's over 100, and then peptides are less than 100. The reason why peptides are great for a few different reasons. There's peptides that are for like regenerative peptides to kind of help the body heal. There's also growth hormone releasing peptides or growth hormone secretagogues. And there's, a bunch of other peptides that, have miscellaneous purposes. The skin peptide, peptide for your skin. There's peptides for hair growth. But the real reason why peptides are great is that peptides are like very, very, very specific. So the side effect profile compared to a peptide versus a full-blown anabolic hormone like testosterone or estrogen or progesterone, much, much less. I mean, I've never had, of our 7,000 patients, none of them have ever had a major side effect on peptides. The most common thing that can happen is sometimes you can get like a little like injection site irritation or like fluid retention if you do way high of a dose. But even so, I mean, it's super safe. So like when you inject a peptide, if you're doing one to help heal, for example, your body is being told, a lock and key specific mechanism. So it's not like going to like an area of the body that's not supposed to target. So it's fascinating. I think in the next 3 to 5 years, I mean, peptides are going to be blown up. They already are, which is why the FDA is trying to regulate them more effectively. And when I hear the FDA trying to regulate, it's not because they're unsafe. It is because there's money to be made, a lot of money.
They want to be mainstream.
Yeah. The FDA wants them to be more mainstream, and a few of them are already FDA approved for certain conditions. Like the original one is Simorel, and that was like one of the first ones that came available. Which people don't realize this, but peptides have been around since the 70s. So they all became popular because back in the 70s and 80s, when growth hormone really was big, there was a huge shortage of peptides.
Can you just aim that mic at you a little bit?
Oh yeah, sorry. So there was a huge shortage of peptides. So it was mostly because there was a lot of people that kids were underdeveloped with peptides, and a lot of times, back in the 70s and 80s, the bodybuilders of the day, everyone started realizing, oh my God, growth hormone. So there was like a huge shortage of growth hormone. So Big Pharma actually started making these peptides back in like the 80s. And then by the time they put all this money and effort, they made all these peptides, Simorelin, a bunch of these good ones, Ipamorelin. All of a sudden, another big company started making another brand of growth hormone. So basically, all that money and everything that was invested in time basically got put to the wayside because growth hormone came back available. So there was like a certain group of pharmacists that really got together and was like, these things work. Like comparatively, way more cost effective than true HGH. It doesn't shut down your body's own production of growth hormone or affect your hormone production level at a systemic level. So, I mean, they're way safer. So a lot of these pharmacies, it's like, you know what, we can, really treat a lot of conditions with these things. So that's where kind of peptides came from. And I mean, they've been way more popular overseas, other countries for longer. But now, in America, with people realizing the safety of it, I think it's going to be, the revolution.
Now, are peptides considered a PED?
No. So peptides are not enhancing they're making your body produce its own production, whether if it's a growth hormone releasing peptide, for example, you're not getting it from an outside source. So it's basically optimizing your body's own use.
So it's not a synthetic, basically.
Yep, exactly.
It's increasing your body's own production.
Yep. So yeah.
Okay.
How most of the peptides work, there are some that work various different ways, but like the peptides, they actually go and they attach to your body's pituitary gland. So as humans, as we get older, what ends up happening is that, we produce the same amount of growth hormone, whether you're 25 or 105. The difference is that life hits us, our pituitary gland gets fried or gets weakened. So what these peptides, a lot of these peptides do is they actually go and they attach to different parts of the pituitary gland, and they actually allow the circulating growth hormone to be used effectively. So it's basically like making your body work back to how it should be,
okay,
optimal levels.
Now, are there age ranges for peptides that are safe?
Yeah, I mean, most peptides, we've treated people as young as, 16, 17, 18, Will it be effective? So, if it's a restorative or a healing peptide, it's going to be effective no matter how old they are. Most people, like if you're like under the age of 25, the chances of there are peptides that will definitely be effective, but it's less likely that they'll be as effective that if you're older and unless you have like an injury. But if you're like a 25-year-old healthy man and you're just trying to like feel better, whether it's recover better from exercise or burn more body fat, blood work can tell, and there are, we've ran labs on people that they've had very low, IGF-1 levels, and they are great candidates for, peptides. But generally, if you're healthy, peptides really, really, really start getting more bang for your buck, once you're over the age of 25. We lose, similar with testosterone, we lose about 1% to 2% of our natural growth hormone production or use of our growth hormone every decade of life. So, yeah.
Yeah, because like I'm interested in peptides.
Yeah.
You get to a certain point, like in your 40s, things start to slow down, and you're like I have an injury.
Yeah.
We've talked off the air. Like these are things that if it's going to help heal and your body regenerate, like why would is there like a stigmatism about it that people don't go and get it? I mean,
they think that and it's mostly because of the misinformation from big pharma or like big conglomerates. And I've been in, I've done primary care. I've done it where someone comes in and says, I started taking this, and this, and you're like, I'm not really familiar with it. I wouldn't advise it. And when someone says that to you, there's no reason what you're taking might actually work, but they're basically just not informed on it. Like when I did primary care, if someone came in and told me about a bunch of herbs and outside remedies that I'm well aware of now, I would probably shun them away. But I think that a lot of these peptides, unfortunately, there's no financial incentive for your insurance company or for big pharma to promote these because a lot of them, they don't make them. So peptides cannot, as of right now, they cannot be patented, meaning that any compound pharmacy can make it. So there's no way for them to say, you can't take Sermorelin or you can't take Ipamorelin because I have a patent on it. Merck or Pfizer can't do that. Right. So a lot of the mainstream medical societies aren't known about them. Most provide. If I talk to five of my previous colleagues that did hospital-based and insurance-based primary care, probably a half of them, would know what a peptide even is, So yeah, that is why it's not really well known. There's certain circles, like people that are into integrative medicine, it's where they're well known. You go to like integrative medicine conferences about like A4M or any functional medicine conference, and that's all everyone talks about: peptides, testosterone, estrogen, it's like.
Now, are they only injectables or are they pill?
There's oral ones, so there's a few really, really, really good ones that come in oral form. So for healing, for example, BPC 157 body protective complex, it's a great peptide. It's actually from gastric juice, the healing part of stomach acid, and I mean, we've cured people with, leaky gut syndrome, IBS, ulcerative colitis, Crohn's disease. These are all like, autoimmune based conditions that are debilitate the fuck out of people. And, my thing is that if I had a choice between to take something that I only have to do for 1 to 3 months to help myself heal and improve my diet and decrease inflammation in my body versus going on a drug, an anti-rheumatic drug to help my body basically suppress its own immune system, I'm taking option A all day.
Right.
And that's kind of where these come in. So we have a lot of guys, young guys. I have one guy saw Friday that has been on 22 years old and ulcerative colitis and lost 40 pounds and was basically on IV Remicade, which is a infusion, and he has to go to a rheumatologist and his gastroenterologist like once a month. It's like, why? And like, because we don't know what the underlying cause of ulcerative colitis is. There's a couple different theories, but these peptides, not only do they help with like your symptoms of pain and bloating and shitting blood, but they actually help your body heal itself. Isn't that what kind of you are supposed to be as healers? Like you're
right, instead of suppressors.
Yeah, exactly.
Now, peptides are. We talk a lot about men's health here, but females can take them too, right?
Yep.
So it's not gender specific.
Nope.
A peptide works in the body.
No matter what you identify, man, woman, unicorn, you can take a peptide.
Now, if George is recovering from his shoulder, my knee conditions, what's the difference between stem cell treatment and peptides?
So stem cells are pretty remarkable. I hope that they become more readily available. Unfortunately, for stem cells to actually work for people, it's really hard to do that in the United States because they're so regulated. That's why people go to like Mexico or overseas. But the difference is that stem cells, every person, we all have stem cells when we're born and stuff, but stem cells are kind of more of an injection. So there's like a bunch of different types of stem cells that are embryo stem, focus on like the embryo stem cells. There's stem cells that work on like the mesenchymal area, strictly on muscle. The difference really is that stem cells are basically your own body. So like you would go and they would harvest your own stem cells and then, re-inject it. But stem cells are kind of a little bit more, they're great if you can find someone that can inject them and do them correctly and actually get the good ones. Because in America, there's a big regulatory, the ones that actually really work, unfortunately, we can't use. So, so like in different countries, you can use like a differentiated stem cell versus like, the generic, basically take it from whether it's your umbilical, your stomach, or they take it directly from the joint. But peptides, unfortunately, or stem cells, unfortunately, just we're about probably 5 to 15 years away from them. The regulation actually subsiding, I think. And now, I actually just read an article this morning that there's a lot of clinics that are getting yelled at for doing stem cells because, with COVID and everything, a lot of people advertised that this would cure or help with long COVID, and a lot of people were paying anywhere from $5,000 to $40,000 for their own stem cells, to be used. And, anytime you're being charged that much, I get it. People are desperate, they're suffering, but, to pay someone $40,000 is crazy. And that's where a lot of people have stepped in and basically said, this is unethical. But, peptides are a little different because they are natural, meaning that we all have peptides in our body, but you can actually make it and actually make the peptide more specific for what you need. So it's actually pretty remarkable, where stem cells are a little bit more, I guess you'd say, risky. But again, off the record, I don't do stem cells in my clinic, but we have a lot of patients that have used them and they work. I think even locally to us, there's some orthopedics that do stem cells, but the problem is, one, they're expensive, your insurance won't cover it, and if they're not done correctly, you have a high chance of failure or like treatment failure where it doesn't really improve the quality of life, and then you're out $5,000, $10,000 a session, whereas most peptides are in there from $150 to $250 for a 2 month supply. So it's and they're as far as for quality of life, joint pain, decreasing body fat, helping recovery from exercise, sleep, they're all pretty 1 to 2 weeks, you're feeling remarkable after peptides. So yeah.
So beyond, I know we've talked mainly about men's health. How does your clinic address women's health?
So a lot of the stigmatism with addressing women's health as far as hormones again, based off of like, studies from like, early 2000s. So we do, the initial process is the same. We have women do a questionnaire, and then we basically have them go get labs. And, the big thing you worry about, or that everyone worries about with hormones, is, breast cancer. Everyone's worried that, breast cancer and ovarian cancer, uterine cancer from hormones and estrogen and progesterone. And, it's really unfortunate because, we've helped women improve their quality of life. And once they get past that initial misinformation, most women, if they're premenopausal, even before, we have women in their 30s, that are done having kids that are literally on, testosterone and progesterone. And I mean, we're not having them be bodybuilders. They're not competing, naked on a show, although they feel good and they probably could. But these are just women that are trying to, save their marriage. And instead of, having, the unwanted side effects from antidepressants and antipsychotics, they're becoming more, well-rounded and grounded and, more in touch with their bodies, so it's remarkable.
Now, do you have to take different strategies? My wife, 2 years ago now, had thyroid cancer, had
Okay.
the thyroid removed, and she's on a hormone replacement. If you know somebody is post-cancer treatment, does that alter the way you would attack?
Certain ones. So thyroid cancer, thankfully, because, thyroid cancer is becoming more common, but it's also one of the most easily treatable, meaning that it's if I'm going to get any type of cancer, I want either prostate as a man, thyroid as a man or a woman, or skin cancer. But unless it's melanoma, that shit sucks. But anyway, thyroid cancer is once it's removed, 99% of people are on, low dose Synthroid or levothyroxine. But yeah, I mean, as far as like the cancer coming back and stuff after the thyroid is gone, like testosterone and progesterone and estrogen, really no link with thyroid cancer. You're really worried about if, breast cancer. And even then, it's one of those things where, you're going to, similar with men with prostate, you're going to die with prostate cancer, not from prostate cancer. Most women, there are very, 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 very terrible situations. I'm not saying it's a blanket statement for all, but most women will die with breast cancer, not from it, unless you have the BRCA gene. And, I hate to sound like a misogynistic asshole, but, the world would be a lot better place if a woman, did what Angelina Jolie did. If you're worried about, you get the BRCA gene, you have family members do it, just get a double mastectomy.
There's like a genetic thing, right?
Yeah, so there's like the BRCA1 and the BRCA2 gene.
Yeah.
And we have a lot of like OBGYN providers and, oncologists that, send their patients to our clinic, okay, they're safe to start, please optimize their hormones, because it's one of those things where it's not, you're not going to have the cancer grow back or die, in 3 years from, hormone replacement therapy. I always tell people, you're 55 years old, you just got discovered that you had breast cancer, last year, it's completely gone and removed, and I asked them, I said, what were your risk factors? And like, what do you mean? I was like, you smoke cigarettes? No. Oh, you eat pretty healthy? Okay, what kind of deodorant did you have? Oh, they tell me some garbage and cosmetic products that have, all these chemicals in it. I'm like, you're probably, been more exposed to toxic chemicals in the food you eat and the stuff that you put on your body, than compared to what you're going to optimize, in your body. I tell people this: testosterone, progesterone, estrogen, we have those in our body. Now, obviously, too much of anything is, bad, but not enough is also just as bad, So it's like most conditions where testosterone or progesterone is the enemy in men and women, it's likely due to some other factor. Like they used to say that if you have high cholesterol, you shouldn't go on testosterone replacement therapy because it's going to make your cholesterol go up. And I'm like, where is the data that supports that? And like you can talk to any, you can listen to any functional medicine provider, even some regular providers and cardiologists, like, cholesterol doesn't rise from, eating a cheeseburger. Cholesterol rises due to inflammation in the body, in the arterial walls, and that's what causes the plaque to build up, and that's when you die of a heart attack. Testosterone is an anti-inflammatory agent by nature. So why would something that helps decrease inflammation increase your testosterone?
I just asked my doctor literally yesterday, I said, when I was a young man and I was a lot thinner, like I was low percent body fat wrestler, I had high cholesterol.
Yeah.
It's genetically high.
Yeah.
I'm like, I get it. I'm out of shape and heavy now, but why? Like, why are they get obsessed with these? Not like that. Oh,
Yeah.
well, no, you need to take high doses. I'm like, I'm genetically high. They're like, well, that makes it work. I go, yeah, but there's people that run. It's different. I don't understand. Like when I was eating healthy and at a low body fat and exercising like crazy,
Still
I was
high.
genetically high.
Yeah.
So where like what is there anything out there like for cholesterol that's not a statin that?
I call it the statinization of America. There are like IV agents that you can go to a cardiologist. If you have familial or genetic high cholesterol, there are agents that tend to be better for you that you take like an IV of. I think it's like once a month for a couple months, really blast this thing down. Your insurance won't cover it. It's very expensive. But, what's fascinating is that you can lower someone's cholesterol very simply. What you eat does not cause your cholesterol to rise. How your body, like, the microbiome, everyone hears that probiotics, like what's going on in your gut will actually help contribute your cholesterol to rising more so than the food you eat. The problem is that, to actually test it, you got to go and poop and things like that. We work with a company called Biome that does that. But, I tell everyone, losing weight obviously will help, but, decreasing inflammation in the body, if you doing all the right things, obviously your diet, exercising is great, but, decreasing inflammation in the body and hormones, we've lowered plenty of people. I've had 40-year-old men, total cholesterol of 350 before testosterone. 6 months later, 135. It's like,
Wow. You've got to be it's got to be a little bit refreshing now that you're having
it is
the mainstream medical world reach out to you and say, hey, let's work together.
Yeah, when I first opened up, when I first started doing this, it was, every colleague that I worked with, would call me, why are you doing this? Where's it, like basically questioning what I was doing. And even my wife said, do you ever feel like, your colleagues are going to think you're not practicing real medicine? And I looked at her, I was like, define real medicine.
Right.
She said, well, like primary care. I was like, you think that's real medicine? You think going in and having the nurse check off a bunch of sheets, oh, how are you sleeping at night? And then, they take your blood pressure, and then your primary doctor come in and sit next to you, look at the same questionnaire, retake your blood pressure, and say, all right, so what's been going on? Oh, I'm not familiar with that. Oh, you got to see this person for that. That's not real medicine, It's like, so it is refreshing, to answer your question. It's rewarding. It's, when you could actually look at someone and not look at their labs and say, oh, this looks normal, which, the word normal does not exist in my world. Optimal is really, but, this is normal. So, I can't, there's nothing really I can do for you. Continue doing what you're doing and go see all these specialists that, are going to do the same thing, but, charge your insurance a copay and go from there. It's like,
and going back to what George said moments ago with his cholesterol, what's normal for him genetically, it's not going to be what's normal for me or for you or anybody else.
Yeah.
So
it's
optimal is the better word.
I always tell exactly, and I tell everyone, like if everyone's like, oh, testosterone is dangerous. It's going to make their cholesterol go high, and they're going to have a lot of people have to go on statins. And I'm like, why would anyone have to go on a statin? I ask everyone, like, statins, 50 years ago, and data's come out, in the last 6 months to support this. So 60 years ago is when statins really got big. And, everyone and their mother's on a statin now. If you fart or say the word cholesterol, your doctor's going to put you on a statin. No, you're at a high risk for a heart attack. You got to take a statin. And I asked them and said, well, in that time, if you look at cardiovascular disease and death versus when it first began, and now it's still the top 4 freaking killer.
So what's a drug? It hasn't dropped
what's the drug doing? Right. Why? What is going on?
Yeah.
Where's the exactly? And I argue, and I can, there's data to support this. The only reason why people aren't dying more from this, from cardiovascular disease and basically statins useless, is because back in the day you would go to your doc, I'm having a heart attack, I'm having chest pain. They would send you to the ER. Now you go to the ER, you're having chest pain. They have way more advanced diagnostic procedures, so you can catch it earlier. That's the only reason why more people aren't dying from a heart attack. The survival rate is better with if you're having a heart attack. It has nothing to do with preventing the damn disease from happening. And that's the whole point. It's like, you got to put people on statins. Like, well, people don't realize there's a direct link between being put on a statin and developing type 2 diabetes. Now, from a systemic point, what do these two conditions have in common? They both cause inflammation in the body. So you give someone that's a drug that's supposed to help lower their cholesterol, it's going to put pressure on the liver because the statins are terrible for your liver. It's the liver is basically your filter for your body. So now your liver is basically going to, be told from, this drug, that you're under duress, and then it's going to cause inflammation in other areas of your body. And then over time, most people that go on statins, they gain weight, similar to antidepressants, and they develop insulin resistance, high blood sugar, and then guess what? Now you have another pill to take. I'm going to put you on some metformin, which is good for some people, but some people it fucks your gut health up even more. It messes up your gut health even more. And then now you're getting another drug because you're going to develop some type of GI issue related to the drug that you were put on, the two drugs in the first place that you probably didn't need.
So
this is getting later. I got a handful of Skittles today.
Yeah, exactly.
Well, that's exactly. We're getting to where like we need to be in that weight loss thing.
Right.
But what you just said is you put it all together. Oh well, your cholesterol's high.
Yeah.
Now I'm going to give you this. Now you're looking at diabetes. Now you're looking at this. So all these medicines just keep pushing,
piling on.
Yeah. And so we're bigger guys.
Yeah.
What does your clinic do for weight loss? And what would?
I just want to say I'm on my ideal weight if I was 8'3".
Yeah, listen, man. Just stretch it out. Just get taller and taller.
Yeah.
So I mean, we are not one of these clinics that charges people monthly for these weight loss drugs. There's a lot of clinics out there, and I don't want anyone to devalue their time or their service. That's fine, but there's a lot of clinics that you go to and they will charge you $600 or $700 a month for these drugs, and they give you the script and then they never want to see you or talk to you again. That's not what we do. We don't have a monthly premium for our weight loss program. It's really not hard to manage someone's weight loss with these drugs. Now, what we do as far as weight loss, we do a very standard, very comprehensive panel. And we do offer these drugs, the semaglutide, the Mounjaro or tirzepatide. We offer a lot of these peptides are really great for weight loss. And, we have a whole questionnaire. The questionnaire for the weight loss is actually a little bit longer because I want to know, how much you're exercising, what are you eating, what does a typical meal look like. I actually will do it, and we'll actually calculate your basal metabolic rate for you, and also your active metabolic rate, which actually determines how much calories your body is needing to burn to actually lose weight. And, our goal is to help you basically customize and we don't offer specific diet plans. We can, but we don't charge extra for that. We have a few nurses that are in my realm as far as for integrative and functional medicine, and actually want to actually start doing more comprehensive coaching and diet plans for people. But for me myself, the guys or women that come to me on my panel, I don't charge anything extra to whip them up a diet plan that they're probably going to follow for a couple of weeks, and then once these drugs kick in and make them lose a lot of weight, they're not going to follow it anymore because they're going to feel better about themselves. But that's a whole nother topic. I think the pushback on these drugs that's been happening over the last couple of months is kind of invalidated. So these drugs are great. We have men and women losing anywhere from 20 to 50 pounds in 2 to 3 months. It's great. But what people don't realize is with any type of drug, if you put the work in on your end, it's great. But a lot of these, there's been a lot of negativity with these drugs in the media and the news. It makes people look older, or it makes people lose muscle. And I'm like, that's crap. Any drug or any agent, if you lose 20 to 30 pounds in a small period, whether it's a medication or an illness or bariatric surgery, you're going to lose a little bit of muscle. Now, you can combat that by doing things on your end, on the patient's end, which is what we go over, resistance training. I don't care if you're a 90-year-old woman or a 29-year-old man. This belief that you need to get on a treadmill and run for 45 minutes, 4 days a week to lose weight is crap. You don't lose weight doing that. You lose muscle, and you will burn more calories by picking shit up and putting it down like that jackass on the Planet Fitness commercial. But I'm not telling I don't tell people to go and be a bodybuilder.
But you're burning lean. You're actually you're ridding your body of lean muscle, right?
Yeah. And my wife, got she's great, very good shape. She, it's been a long process, but it was like a cycle. Any one of these type of endurance athletes or people that think that I have to get on an elliptical or a treadmill, I have to do it for 45 minutes a day or 3 days a week, otherwise I'm not gonna lose weight. It's especially if you're a woman, you're actually doing more damage to your body doing that. You're gonna put off your cause very high levels of cortisol. You're gonna throw off your sleep. You much better body composition by lifting weights. And like I said, I'm not don't try and deadlift 400 pounds or be a bodybuilder, but resistance training, whether you're a young woman or a woman going through menopause or even older than that, to prevent osteoporosis and breakdown of your bone is way more beneficial, and you lose more fat and preserve more muscle doing it that way.
So like you guys do semaglutides, right?
Yep, semaglutide. Yeah,
And it works in your system. It curbs your hunger, but is there other benefits besides just weight loss?
it's fascinating. It is a fascinating drug. So there's a lot of research coming out that it helps regulate your thyroid hormone, which is like your master energy gland in the body. It also has like nice anti-aging benefits. There's scientists that have actually pinpointed it actually goes in and helps penetrate the mitochondria, which is like the energy component of the cell. So like at our clinic, we have a lot of women and men that have, say they get to their goal weight of, they lost 30 pounds or 40 pounds. Most of them we will wean them down instead of cutting off completely, which is what a lot of other places do, and then get this, not you won't get a big rebound weight gain like a lot of these other drugs that have been around, but we wean people down, and we have people on maintenance drug, like very, very, very low dose, because of what these people find out the data, the anti-aging, it's good for your skin, and it actually helps correct, how this drug works. It helps correct the body's response to insulin and glucose in the body with the glucagon-like peptide 1, hormone that it's activating. So it's fascinating. It really is. So it has like anti-aging benefits. Like I said, it helps regulate people's thyroid, and they're actually using it now to lower cholesterol. Isn't that fascinating?
Yeah. Wild stuff.
Weird
how that works.
And addiction. We have a lot of alcoholics or people with substance issues that have been put on this drug, and there's another one coming out, which in the next couple of years will be big in the U.S. The studies that are being done in retroglutide. It's going to be probably more potent than Mounjaro or tirzepatide, which is supposedly better than semaglutide. So these class of drugs aren't going anywhere. They're going to be peptides, and because these are semaglutide and tirzepatide, they're actually peptides. They're glucagon-like peptide 1 agonists and glucagon GIP agonists. So they're all peptides. So that's why it's just fascinating.
Nice. I did have one question. My brother-in-law, of course, comes in with one. Do you have any services that can help other people, older people, who are on decent amount of medicines that are looking to increase their energy without raising their blood pressure or heart rate?
Peptides. I'm telling you, there's a peptide called MOTS-C. It is a peptide that basically mimics what exercise does to your body. But I tell everyone, it doesn't mean don't exercise. But as far as what it does to your energy-producing cells, the mitochondria of your cells, you inject this drug. If you have the money to do it, you do it like 3 times a week for 2 weeks, and then once a week for you can do it for 6 months if you wanted to. But it's a great, fascinating drug. And a lot of these peptides, they are safe. AOD, which is anti-obesity drug 9604, is great. For energy, there's CJC 1295 and ipamorelin. A lot of these agents, the way they work, especially if you're on these peptides, they help you sleep better at night. And I mean, not like taking melatonin or Ambien. This is like restorative sleep. It goes in and actually makes it so your REM, your body recovers, and I mean, you have like real improvement in energy and focus.
It's like I have, and George does too, obstructive sleep apnea. That combined with the use of the CPAP machine, that's tremendous. Yeah.
I guarantee both you men, if you both have sleep apnea, you guys have your testosterone levels checked?
I haven't.
I guarantee it's low. It's a chicken versus the egg. What came first, the low testosterone or the sleep apnea? So some people believe that if you suffer from low testosterone, you will have sleep apnea. Some people say if you have obstructive sleep apnea or a form of sleep apnea, you'll have low testosterone. Obviously, I mean, from a basic level, you would probably think that the sleep apnea affecting your sleep will probably be throwing off your hormones, but there's it's very interesting. There's a lot of people that say that, low testosterone, will contribute to, sleep apnea, So it's very fascinating. I listen, I used to snore really, 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 really bad for testosterone. Like to the point where my wife before kids didn't want me sleeping in bed with her. She still doesn't want me in bed with her now, but I don't snore anymore.
Yeah.
And I'm also nasally and stuff. But yeah, no, it's very fascinating. And I mean, CPAP in itself is, they're pain in the ass, But,
1000% agreed.
But we have a lot of men on CPAP with CPAPs that have sleep apnea, and that was their biggest fear. And we put them on testosterone. They feel so much better. They lose a little bit of weight. And, most of them are using the CPAP still, but they loving life.
This is like a half-assed joke question, but in I'm interested in a way. Do you have like a group discount? Like what if What if,
Yeah.
like, say, a soccer team or somebody
Yeah, yeah.
came to see you? You know what I mean?
Not only do we have like a discount for patients, and we have like a whole referral program. You know, we can't technically advertise it because there's some BS law, the anti-Stark law. So basically, if you're a medical practice, you can't give discounts for people referring to you. So what we have at my clinic is for people like current patients that want to spread the love. Every time they send 4 people our way, for some reason, my credit card processing company just happens to skip your monthly payment. I don't know what happened. It's a glitch that happens in the system. But yeah, I mean, right now we have a special. I don't know when this is going to air, but we have an ad going on right now, which we can give to all listeners of the podcast. But basically, we're taking anywhere from $50 to $100 off your initial visit. So like we have a one-time. If you're coming to us for weight loss, for example, we have a one-time consultation fee. Depending on how many meds you qualify for, you get, the consultation fee starts at $100 extra, whatever the med is. And if you get like more than one medication, we lower the consultation fee because we're not trying to make $1 million off of people. But right now, like we basically take $50 off the initial consultation fee for everyone, and we could do something like that for all your listeners if you want. Just have them say, the podcast sent a thing, that's fine. And like we've had a rugby team last year that all saw us at once, and we gave them all like 20% off because it was like 10 guys that had fucking injuries. And
right. Well, and that was my
Yeah.
idea exactly. Right.
Yeah.
Because if you get a team like the Kingston
Yeah.
Football Club
Yeah.
there, that's the soccer team, right?
Right.
What are they called?
It's something to do with Uptown.
Stars. What are they called? Stockade.
The Stockade.
Yeah.
Yeah, something like that where
Yeah.
they come in and
Yeah.
what I mean, the peptides or whatever,
Yeah.
keep them energy, whatever. I figured like that's kind of something you want to get.
You've had some local guys,
with.
jiu-jitsu people that own like a jiu-jitsu club locally, saying like 5 or 6 of them come. We give some form of discount, Yeah, but yeah, any one of the
Cool.
listeners.
So we'll work something out,
Yeah,
and we'll put it up. We'll
code.
put it up
Yeah.
with this a promo code as he knocks the microphone
Yeah.
for the 7th time.
Yeah.
So where do you see your company being in 5 years?
So right now we have one main location in Kingston, right on Albany Avenue in Kingston. We've been actively over the last 1 year, year and a half, looking for a bigger, nicer space. Which I don't care about the space, but I really want a bigger space because we are going to start doing more like in-person biohacking ability, like stuff. Like we're going to have like full on like cold plunge and fucking cryotherapy.
I'm big
sauna.
I do cryo. I'm big cryo.
Yeah. So that's our goal. We, like energy medicine, all this holistic stuff is what our real goal is.
Double anti-inflammatory.
Yeah, exactly. I mean,
Peptides
listen,
and
I was there this morning, 4:00 in the morning. My cold plunge. Like 39 degrees. Nothing like making your nuts go up to your throat. But no, I mean it's fascinating. I mean, talk about seasonal affective disorder. If you live in the Northeast, you want to get depressed. You instead of going to antidepressants, stick your body in some cold water. I say it's like we got 2 young kids at home, so I put my ass in that cold plunge first thing in the morning. My kids wake up, they're screaming and fighting. It's like it doesn't matter. I just froze my ass off. My body feels good, inflammation. Yep. So, but yeah. So we're in 31 states right now. We're trying to be able to be in all 50 in the next few months. And my goal in the next 3 to 5 years, I want an office in every, most major, states. And the goal is just help as many people as we can. The providers that we have work with me now are great. Our staff is great. We got a bunch of rock star office staff helping out, and thank God for them because I'm really disorganized. And but yeah, the goal is to help as many people. And like I said, the brand will probably change, and I hope to be able to treat every illness or most major illnesses with like more of a holistic, integrative approach without you having to come to my office and buy, 400 supplements like some of these other functional,
Right.
Clinics are. But, you could solve most people's problems by optimizing their hormones and gut health, like it's very simple, 50 years ago, people didn't have, rheumatoid arthritis and ulcerative colitis and Crohn's disease, and it's mostly the crap that we're eating in our food and what we're exposed to. But, most people don't want to tell you that. Instead, they want to sell you on this pill.
Right.
And, one thing I hope that comes across in the interview today and us talking off air is a lot of people have fear of going to a doctor because they don't want to get browbeaten.
Yeah.
They don't want to be yelled at. They don't be told you're doing this wrong or this wrong. You have a very approachable approach.
Yeah.
I guess for a better way of saying it. But we know what the problems are. Let's work together to fix them.
Exactly.
It's not you need to do this, and this, or it's not going to work.
In my chart, you'll never see, in any of our charts, you'll never see someone say, blah, 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 alcoholic came in, and wanted help. And, we don't label people like that. Once you put it, it's funny, one of my original mentors when I first graduated school told me this, and I get it, like when you put in someone's chart, person abused testosterone or person has a history of alcohol abuse, that stays with that person forever. My father-in-law is going through it right now. He had a heart failure developed, I think either from COVID or the vaccine, they don't know, whatever. It's a whole different topic. We spend days talking about that. But, now every time he goes to his cardiologist, they have him on, they want him to take fucking statins and all these drugs. He's like, listen, I'm 52 and, healthy. I'm doing marathons, why all of a sudden is my heart so unhealthy? And now I have to have all these drugs, But anyway, every time he goes, he can go to his primary doctor for a cold or an allergy. And, oh, you have heart failure. I'm very hesitant to give you this, and this. It's like, why? Like, people just don't stop and think this is a person that is seeking help from you. You could sit here and you could label them and make them feel like shit and go see another provider, or you could actually not worry about one being sued for giving someone a alternative medicine, and two, most people when they go to a provider, especially men, when men come to us, I know that they want help. My father, God rest his soul, died at 48 of a heart attack from a stubborn guinea, assuming Italian. He freaking chopped half of his thumb off, and my mother had to. I remember it was yesterday, yelling at him, "Go to the effing hospital!" He literally drove home from the city, taped it up with, So men don't want to go get help, and that's why I tell any man, when you come to us, I already know that you're struggling. When the fact you're coming to us and you're asking for help with this, crazy or alternative type of medicine, I already know that you're going to be not an asshole patient. So I just tell people, maybe it's a character flaw, maybe it's, I'm a little bit of a pushover, but I see people how they are, and I didn't get into medicine to talk down to people. This goes more than just beyond medicine. If that's your only way of dealing with people is to have this power complex that most healthcare providers have, it's you've gotten the medicine for the wrong reason. Go be a lawyer, go be, not to stigmatize lawyers. There are really a lot of really good lawyers. I'm saying, go be someone that you wake up and you're going to attack someone and that, that's your MO. But yeah, it's definitely rewarding to be able to treat people that want to be helped. And that's kind of one of the reasons why we don't accept insurance, to be honest with you. When you accept insurance, first off, they won't cover most people's treatment, especially for men with testosterone. But when you accept insurance, you are taking people that don't necessarily want to be helped, but their insurance company saying, "Oh, go see this person. He's taking new patients." And it's okay, it's kind of a gimmick.
Yeah.
And again, with regular medicine, general medicine like that, it was you go in with a sore shoulder. All right, so let's go through 18 rounds of physical therapy before you even look to see what damage is in there.
Yeah.
I never got that. I never understood that.
There's a very famous saying, and I'm probably going to botch it, but doing the same thing over and over again with the same results, or despite despite knowing the consequences, that's the definition of insanity.
Yes,
right.
100%.
And when I talk to other providers that kind of push back up against us, what we do at my clinic, I'm like, you're telling me that we're treating people wrong, and that's not how we should be treating people. I'm like, are we actually treating these people right? Whether it's depression for men and women, high blood pressure, heart attacks, cancer. Are we actually treating people right? You put these people on chemotherapy, agents to kill the cancer, and it's what is that doing for that person's body after you wipe out that cancer? You're going to ruin their quality of life. It's so it's one of those things where sometimes people, and again, when you're in the trenches as a healthcare provider, you're doing this day in and out, the burnout, and I get it. You just want to come in, do your job, and go home. That is a whole different scenario. You shouldn't be practicing medicine if that's the person you are. But, most people in anything in life, whether it's parenting or, work, medicine, just taking a step back and really ask yourself, what the hell are we doing here? Especially in medicine, the whole, COVID, it's a whole different scenario that, whatever. But just regular, high blood pressure, how many times I see people, I'm like, okay, you're 27 years old, about 30 pounds overweight. You tell me this is what your diet, and now you're primary care doctor has you on 3 different blood pressure medicine and a diuretic to help you, take off fluid, and now your fucking potassium's, your potassium and sodium are low, your blood pressure's still not better, and as a society we still think that salt's the enemy. Oh, you got to cut down your salt because it's going to cause high blood pressure. There's no data to support that. It's like one of these gimmicks. There's no
myth.
You know how much salt I eat. My blood pressure's great.
Yeah, like my it's like my father-in-law. He has heart failure, so like, oh yeah, you can't have a low salt diet. I'm like, did the fucking cardiologist actually check your blood pressure? Like, did they actually look in your blood, check your blood pressure like 90 over 70? I'm like, give this motherfucker, some salt if you think that it raised your blood pressure, which it doesn't. It's like people don't realize it's like 50 years ago, like people didn't care about salt. Like salt is like was like looked at as gold, Himalayan salt, like it's delicious, table salt. Salt's not the problem. The problem is that everyone's afraid of potassium. Potassium, like it's all about the ratio of anything, like testosterone's not the problem in men and women. It's the ratio of their estrogen, I could beat it,
Understandably, you have a different mentality, right?
Yeah.
Peptides, you feel you're ahead of the curve of what is the future of medicine.
Yep.
Medicine or
healthcare.
Healthcare. And that's honorable. Like, because a lot of people, they've gone the traditional route and it's not working. So now here you are to offer, hey, listen, there's other ways to skin a cat. Right? Yeah.
I mean, if you would have asked me 5, 6, 7 years ago if I would be sitting here talking about this stuff, like back then I was like, that's some fucking, hocus pocus, talking about like energy medicine and helping people heal. What the, who the fuck is, and it's funny. I remember being in the hospital, talking to an infectious disease doctor, talking crap about a local guy that does more of a holistic method who would like, heal people with, Lyme disease and like, oh, you have chronic Lyme. And there's no such thing as chronic Lyme. You have to get bit by a tick. And like, what people don't realize, like this particular doctor wasn't talking about getting Lyme disease again. He was talking about like the symptoms that happen from having chronic inflammation in the body. You want to know the funny part of this story? This doctor, he's a brilliant infectious disease doctor, I may add. He was such an asshole against him. 3 years after that whole conversation, he got fucking Lyme disease and went to this guy and feels amazing. It's like, it's like weird,
Right, until you wake up to the fact.
Exactly. Like I said, if you're a young man or a woman and, you really want like to take an ulterior approach, like manage your symptoms and feel better, I really tell everyone, obviously don't just come to my clinic. There are a lot of clinics that do what we do. But I just tell everyone, just, do your research, and really sit down and ask yourself, like, am I feeling better going the traditional prescription medicine route? You can do that with any depression, another thing, we put people on antidepressants, come back 6 to 8 weeks later, and it's like, okay. And then all of a sudden, they're feeling better, placebo effect. The data just studies to support that. And then, then the law of comfort happens, right? So like you're on antidepressants for 6 weeks, 8 weeks, you're feeling a little bit better. Instead of that provider saying, okay, you've got from point A to point B, you're dealing with a death in the family, you're dealing with a divorce, whatever the situation is that's going on, right? Mm-hmm. You get to that point, no one, and maybe there are providers that do it, but not that I've seen, no one is coming back and saying, okay, you've been on Zoloft for 8 weeks. Life is better at home. Let's wean you off of it. No, because they're saying, oh, you feel a lot better. You're saying, let's just keep you on this drug forever.
It seems like that's right. It seems like it's easy to get on, and it takes forever to get off. You can't come off of that.
God, no, you're gonna become depressed and suicidal. It's like, hold on. So you're telling me that I have to start this drug to treat my symptom, and if I stop this drug, there's a chance I'm gonna go back to what I was doing. Right. So what am I solving? And that's that's the whole point. It's like there should never be in pharmaceutical, even back in the 50s, when Big Pharma first came around. Most drugs were never made to be on forever,
Right. It was the subside whatever the issue was and move on.
Exactly. That's how drugs were originally made.
Yeah. Do you have any social media besides like Facebook? Do you have a Facebook?
I have Facebook and Instagram. It's just Stracuzzi Wellness. I have a TikTok, but I'm pretty sure I have 1 follower on it. I just got on it one day and then it kind of went away. That's like our next thing to kind of get it up and running. I know it's like the future. My brother and everyone, people that are like 20 years older than me say, you gotta get on TikTok. I'm like, but yeah, we have a social media.
Good.
We're gonna come up with over the next few weeks, we'll be putting out a lot more content as far as like videos and stuff to really try and push the agenda out, because not that we've been hiding in the shadows, but up until now we've done really no marketing. It's all been word of mouth. We have a marketing campaign out right now, but you know, we have the infrastructure to set up to really, really, really help a lot more people, which is what our goal is.
Good.
Awesome.
Anything else, Bud?
No, it's been great having you here. I'm glad we finally got you in the studio.
Yeah.
And if, again, like this interview reaches out and helps 5, 10, 15, 20, 100
That's
people.
all that matters. Exactly. You know,
That's what
Right, and we're gonna figure out a code or
Yeah.
a coupon type thing if you mention the podcast,
Yeah, definitely.
and we'll attach that to the video, which will be on YouTube and all that, and it'll be on the Facebook
We'll run it
Live
through
and
our
all that.
social medias as well.
Yeah,
Awesome. Yeah. Look forward to it. Like I said, you know, help as many people as we can, and you know, who knows, 6 months, a year from now, maybe we'll come back and see where everything's at, and you know, that's great. And I'll help blow up the podcast too. You know,
there we
Sounds
go.
good.
Sounds good.
put a bumper sticker on. You know,
There you go.
All
All right, take us home, big guy.
All right, for Pat and G-Mac, this is Winnie. This has been the Outlaw Blitz Interview Podcast, and as always,